And I'm Danielle Augustine.
And we are here with Project CHEER, which stands for Community Health Education and Exercise Resources, which is a CDC Disability and Health Branch funded grant effort through the University of Kentucky's Human Development Institute and in partnership with the Kentucky Division on Intellectual and Developmental Disabilities. And our project goals are to focus on addressing the startling health disparities for individuals with both cognitive and mobility limitations.
So we work with our population to empower them to make healthy lifestyle choices while also raising awareness to these startling health disparities in community-based organizations and healthcare organizations.
And Kentucky is actually one of the highest rates of disability in the nation, coming in at 29.9%, which I like to say is almost a third of our state. And if you think about how data is captured, that doesn't even necessarily get everybody. Some people do fall through the cracks. So in thinking about a population that we need to serve, it's a large population. And then if you look at the health disparities that are experienced by individuals with disabilities, they are 3 times more likely to have heart disease, cancer, stroke, diabetes. They're more likely to be sedentary, not have the healthy nutrition, smoke, and have all the negative secondary consequences from that.
So as we'll discuss today in the webinar, individuals with disabilities experience a lot of barriers at every stage of cancer treatment and prevention. So individuals with disabilities often have lower rates of screenings due to healthcare providers' assumption that it may not be necessary. Individuals with disabilities also are usually not spoken directly to. A lot of times healthcare providers will often turn to their caregiver for communication, and they're often left out of conversation. And additionally, individuals with disabilities are often uncomfortable with the screenings, and the screenings aren't properly explained to them, which can cause fear, and then they don't volunteer to do them.
So in starting this partnership with Marquis Cancer Center Affiliate Network, Project CHEER is excited to begin those conversations and having self-advocates come today to provide this webinar to talk about their experiences in the healthcare setting, to raise some disability awareness and etiquette for your network. And as we continue this partnership, Project CHEER will work to provide additional resources on universal design, adaptations, and supports so that you and your network supports can be comfortable supporting individuals with disability in what you do.
Hi, I'm Morgan Turner. I'm a Special Olympics athlete and athlete ambassador from Lexington, Kentucky. I was born with hydrocephalus, abnormal left hand, and abnormal legs, and I work with HDI.
I'm Jason Jones. I am the coordinator for advocacy at HDI, as well as work with the Southeast ADA Center as the Kentucky rep, and several other projects across the Human Development Institute. I was injured at age 15 in a high jump meet in high school. I broke my neck at cervical 4, paralyzed from the chest down, and that was in 1990. So going on 28, 29 years now.
What barriers have you personally experienced as an individual with a disability in the medical and healthcare fields?
I think there are several things that are pretty common as far as dealing with doctors, nurses, that kind of stuff. I feel like very often they have a preconceived idea about a disability, or they have no idea whatsoever. There needs to be some, and in some cases they think they know a lot more than they actually do. I've had experiences where doctors ask me questions like, do you know what dysreflexia is, which is a significant dangerous condition that can happen with spinal cord injuries that if I didn't know about it, I would probably not still be here. And this is 10, 12 years after my injury. So that's one thing. Another thing I think is that sometimes doctors are reluctant to ask questions. The best doctor I've ever had for sure was someone who said, I don't know everything about spinal cord injuries, but what I do know, I'll use, and what I don't know, I'll ask you, and I'll go find the answer. If you run into somebody that's pretty obstinate about kind of what they expect from somebody with a disability, or anybody really, I mean, stereotypes can be, you know, any type of person, then I think you probably need to get out of that relationship.
Right.
I think primary care is where the breakdown happens. A good primary care person is the person that kind of gets you there and is not afraid to send you to somebody else, to talk to that doctor, to be a collaborator. And in those cases, you've got a winner, and you just hope they never quit.
Right.
So, a couple of other things that I think of are accessibility in doctors' offices. There are very few that are accessible. A lot of doctors want you to get up on their table, which for me is an impossible thing. In time, I think is something that doctors could do a better job of. There are some situations where there needs to be a deeper conversation,
Yes.
especially initially, and I think that's overscheduling sometimes, or not understanding that somebody with a speech impediment, or someone who may have some other kind of disability that may take a little bit longer to flesh out sort of what they need to tell the doctor. There needs to be more time scheduled for those kinds of things. And you know, for me, my disability is obvious, and so I think as soon as I come in the door, someone has to really kind of engage and start figuring things out. And I know with you, your disability is not as visual. So what are some of the things that you have kind of faced in the same situation?
Well, when I'm wearing pants, obviously no one can really tell that I have a disability. They just see maybe a limp at times. And people, like I said, don't realize that I have prosthetics because of that. They just think I got injured or something. But then when I'm wearing shorts, it's more visible, obviously, that I have prosthetics. And then people will talk about, or they'll come up to me and they'll immediately thank me for my service. And
I get that too.
And I just pause because I don't know what to say, and then I just finally say, "Thank you, but I wasn't in the service." I'm one of those people that I'm an open book. If people can ask me questions about my prosthetic, I don't mind to tell anybody what happened to me.
Do you feel like physicians sometimes, I mean, I think overall in the world, people are reluctant to sort of ask those questions, although most people I know with a disability would rather them ask than to just, you know, assume or come up with their own idea for what they think happened. But do you think physicians are reluctant sometimes to dig in to really get to know you? And if so, then, you know, why do you think that is? What are some reasons you think that happens?
I think that people, at first, they're shy to say anything, but like you said, most people with disabilities, they would rather you ask them questions about what happened with your disability instead of just staring at you and pointing like little kids would point, or freak out because they think I'm a robot or something. And that's not the case. And now parents are even like, kids will be like, what happened to his legs? And then the parents will say, well, why don't you ask him?
That's
and,
great.
Yeah, and I do not mind telling anybody what happened, even if they're young. I'll tell them. I may joke with them at times, saying, "Oh well, I'm part Ninja Turtle," but no. But most of the times I'll tell them straight up like what happened.
Yeah, it's great. Do you have any personal experience, personal stories about? I mean, I know one thing that me and you have talked about before, and hear a lot is that, you know, sometimes we're sort of, if we're with somebody else, they're the people that get the questions, and people are a little more reluctant, especially in the doctor's office, to talk to us directly. Have you experienced that yourself?
About doctors?
As far as, yeah, like a doctor speaking to whoever's with you instead of speaking to you and asking you the questions.
Not really. When I'm at a doctor's office, they tend to talk to me and the person who is also in the room. So maybe if I don't understand what the doctor is saying, my mom can, or whoever is in the doctor's office with me, can go through what the doctor is saying.
Mm-hmm. And for me, I've seen the extreme both ways. I've seen the doctor that was very engaged and wanted, you know, to kind of ignore the person with me, and I've seen them almost say, "Can he speak?" you know, almost
Yeah.
to that extreme. So we both experienced some of that. Yeah.
Okay, if you were to be diagnosed with cancer, how do you feel your treatment plan would differ from someone who does not have a disability?
Well, honestly, I would hope that it wouldn't, but I think some things that I've seen over the years, or in my experience, it does differ. And you know, when you have a disability, you have much higher rates of all kinds of things, diabetes and high blood pressure and just heart disease, being overweight, those kinds of things. It's a little more difficult to exercise and do the things that you need to do, short of eating well. That's probably the best thing you can do for yourself to stay healthy. As far as cancer goes, the difficult part is, I think sometimes with diagnosis that is that significant is that depending on where you are in the continuum of your disability, and like I said before, I've been in this chair for 29 years. I think there's this idea of you reach a certain point, a kind of a tipping point, to where people in the medical field and just in society that, well, he's had a good run. So sometimes they're a little more reluctant to offer experimental treatments, transplants even, risky surgeries, those kind of things. I'm thinking that possibly you've been around for 60 years, you've probably beat the odds already, and maybe it's not in your best interest to, you know, do something a little riskier to maintain life for longer. In my experience, you know, I'm married with kids. I would think at 44, which I am now, I would think if I found out today I had cancer, I would want to try to do something about it.
Right.
Even though living 30, 40, 50 years in a wheelchair is usually pretty difficult. But we beat the odds so far, right? So,
right.
So why not? And I think that it's almost fair for a doctor to think that, but it's not fair if they make that assumption without talking really in-depthly with the person to
Right.
find out what the treatment needs to be.
Right.
So, how would you feel about that?
Probably the same feeling you just said. Definitely 100%.
I think one thing that is ignored is that, you know, when you have a disability, you're managing your life a lot. There's a lot of things that go on secondary from I guess the normal problems that most people have. And if you throw a diagnosis significant as cancer, to where you have to do treatment, take time off work, and still balance all those things in life plus your disability, it's difficult. So I think the emotional side of it needs to be dealt with as well. And I think sometimes there's always two ways of looking at it. Some people like that doctor that just comes in and says, "This is it. This is what we're going to do." And there's a time for that. Listen, I don't care if my surgeon's a nice person as long as they're a good surgeon. But on something like cancer care, where it's going to be a long-term relationship with that physician, it's good to have that kind of rapport. And it's great if they're somebody that's going to be willing to listen and to understand that chemotherapy for somebody else means, you know, if I get sick in my stomach, I don't run to the toilet.
Right.
You know, and it's going to be time in bed. It could be days in bed. It could be things like pressure sores might occur from lack of, or, you know, just from the problems that come with going to the bathroom a lot. It could be pressure sores. It can be, you know, not being able to eat. So you have other issues, you know, bowel and bladder care and those kinds of things. So finding somebody who looks at the thing in a holistic sort of way, sort of takes in all the things into account, would be a much better way to survive a cancer diagnosis than someone that just said, "You need chemo 5 days a week, deal with it."
Definitely. Exactly. That's why, as a health educator specialist with HDI, we work on making universal designs into health programs and services. And our partnership with Marquis Cancer Center, Get Fit, Be Smart, Don't Start program.
Cool. So let me ask you one question. In many research studies, healthcare professionals cite a lack of knowledge and insufficient training to care for individuals with disabilities as a reason for overlooking screenings and procedures. As a person with a disability yourself, and what advice would you give to these people, the professionals, on how best, you know, to work with you? What can they do better?
Well, I think it's important for the doctors to get to know you or the patient and the people that are in the room with them, and I will make them more comfortable, make the patient more comfortable with the doctor, like talk to them about other stuff, not just health stuff, like what's wrong with their health. You should talk to them about like what their favorite sports are, what do they like to do for fun, talk about vacation with them. And I know for me that helps me, I guess, be more calm in the doctor's office when people are talking not just about all the health stuff and health problems that could be going on, and they just talk to me about pretty much just like a normal person, like a friend almost.
Yeah, and I think part of what you're saying, and I totally agree, is that the more personal relationship you can build with somebody, the better they know you, the better your care is going to be, right? I mean, that just makes sense.
Right, and also a good thing about building a good relationship with your doctor is if something goes wrong with you, more than likely they're going to know an easy fix or a quick fix. Like with my prosthetics, with my doctor, he if I call him up and say this happened to my leg, he pretty much knows what's going on, and he'll get me set up real quick. Jason, what about you? How do you feel about?
You know, I think if I was going to give advice, I would think that there are a few things. I mean, first we know that, you know, I think people with disabilities are more reluctant to go through screenings. I think there's a lot of reasons for that. I think sometimes it's a fear of having something else happen. For me, it's like one of the funny things. It's not funny necessarily, but if I go for a CAT scan, it's going to take me, for a 5-minute CAT scan, it's going to take me an hour. Because by the time I transfer out, find a place to transfer, I have to take my own equipment 90% of the time because most facilities don't have the lift and stuff I use to transfer. And then doing the test, propping up, whatever they need to do, and then doing the whole process in reverse to get back in the chair and go. I think it makes me reluctant to do it sometimes, and I can see why people, you know, what I know of guys who've been transferred and had their skin tear, and it creates a process that can last for 2 to 3 years to get that wound fixed. You know, I think there's definitely a lack of training for transferring, and usually there's a lack of personnel. You can't transfer. A lot of times they just want to get, you know, call in everybody they know and transfer you, and it's just not safe, you know.
Right.
So I think some of the things I would say are, first of all, don't treat every person with a disability the same, even within the same disability. Spinal cord injury affects a lot of people, but it affects every single one of them in a different way. You know, somebody that can plop up on that table and use their arms to transfer is a lot different than someone like me who uses a lift and that kind of stuff. And there's a whole gamut of issues that are involved in transferring, and just access, that kind of stuff. I think some of the things that are important another thing that's important is, you know, 99% of the time the patient knows, first of all, what's going on with them, and sometimes, with the exception of diagnosis and treatment, have a pretty good idea of what they could tolerate, what may be sort of out of bounds a little bit due to, you know, their issue. I know a friend of mine who is a diabetic, they wanted him to take a diabetes medicine that was that basically worked as basically the same as a diuretic, and it just didn't work for him. He was constantly having to go to the bathroom all the time. It just wasn't. It didn't work. They needed to, you know, and when he came back to his doctor, they said, well, we think this is the best treatment. He was like, well, you don't understand. I have to live, right? You know, it has to fit into your life in some way. And I think we all know quality of life is a good indicator of health. I mean, if you're not happy and you're doing nothing but treating something and not doing anything else, your attitude really can affect sort of your longevity, I think. And I think that's super important. And I sometimes think that doctors have too much knowledge in their own minds about things, and they kind of make preconceived ideas sort of apply to everybody. You know, there's a colorectal surgeon here in town that told me at one point that I was going to have a colostomy down the road somewhere because everyone with spinal cord injury ends up with a colostomy. And I know hundreds of guys and women who are, you know, have spinal cord injuries without colostomies. In fact, I only ever knew one that had to go through that process, and it was pretty much had nothing to do with his spinal cord injury. So I'm not sure where that knowledge for him came from, but I know that it did not apply to anyone I know. So, and I assume, I guarantee that I see many more people with paralysis and spinal cord injuries in a year than he probably does. I think, we were talking about transferring a minute ago and tests. The best experience I've ever had here in Lexington is with a group at a CAT scan who everybody wants to help, and at some point I said, listen, I'm here with my wife, she knows how to do this. If you guys could just back up and give us some room, it'd be great. And it bothered them at first, not in an angry way, but like, oh no, we want to help. I was like, listen, you'll help more if you'll just stand back.
Right.
And let the experts do it. And in that situation, they were great. They just like, okay, great, if you need us, let us know. And the transfer took about half the time because there wasn't 30 people having to, be instructed as to the little things that they had to do.
Right.
So you got to ask the question, right? And I think that's the most important thing. I love what you said about developing a relationship. If you walk in the door, I always call it like the Cheers idea, the old TV show. Sometimes you want to go where everybody knows your name, and more likely if somebody knows you and gets to know you on a personal level, then you feel like they care about you, and if somebody cares about you, is going to take better care of you, right?
Right.
Yeah. So do you feel like sometimes doctors sort of discount your ability and make assumptions that you just aren't going to be able to do something?
Yeah, I think it's important that people without a disability should know just because someone has a disability, that doesn't mean they can't do something. Maybe people with disabilities can do it, it's just we do it our way. It may not be how someone wants it done, but we get whatever needs to be done, we get it done.
That's a good point.
Thank you for watching, and we hope you enjoyed and found this information valuable. In addition to the research cited and the discussion here, there is another free online resource through the Ohio State University that is specifically for healthcare providers to train them how to provide the best care possible for individuals with physical, sensory, and cognitive disabilities. This will be linked in our resources below.
And in addition to that, we do have a Wellness for KY website that will also be included in the resources for this video, and we will continue to update our resources there as well as with your SharePoint as we work together to promote disability awareness within your network.